It's the most common emergency surgical procedure in the U.S., an appendectomy. Now there's mounting evidence that some patients can avoid or delay removing the appendix and receive treatment with antibiotics instead. In a clinical trial for an appendicitis treatment, 1,500 patients got either an appendectomy or antibiotics. In the first 3 months, nearly 7 in 10 patients in the antibiotic group avoided surgery 4 years out. Just under half of patients in the antibiotic group had surgery. One woman chose antibiotics over an appendectomy, and she talked about her experience.
It didn't make me feel the greatest. I was really tired. It had like a weird metallic taste. But after I finished the course of antibiotics, fine. I'm like, my life went back to normal. I have not had another episode.
The clinical trial did not include children, but researchers say other studies are looking at whether antibiotics could work for pediatric patients. To get more healthcare workers in underserved and rural communities, the U.S. Department of Health and Human Services is awarding up to $100 million in funding for state-run programs to recruit primary care clinicians to live and work in these areas. Lack of access to quality healthcare is often a symptom of living in a rural or underserved community. There's a hospital located on the southeast side of Washington, D.C. It's the only one in the area compared to 6 hospitals on the city's north side.
We still don't have obstetricians, maternal care for individuals east of the river like we should. We didn't have enough ophthalmologists east of the river. So it was just lack of individuals, professionals coming to east of the river to provide the care.
Now, states can apply for the money to make sure they're taking care of their healthcare workers. The funding is part of the American Rescue Plan, which can be used for recruiting, paychecks, or giving healthcare workers more time off. The application deadline is April 8th. Stay with us. Hutch will have an update to your Monday evening weather planner when we come back.